So committee, I'll open this up for discussion and or questions. More than happy to, Heather. Show Heather Fazio on record as what, Heather? Ending water fluoridation first, and then a warning label if that can't be achieved. So Heather is officially on the list as well. So committee members, the floor is open. We can ask questions of staff, of folks from Fluoride Free Austin, or we can begin a deliberation among ourselves. Councilmember Riley.
Do we have staff here who can answer questions? I think I saw Bert. Anyone else from Public Health and Health and Human Services?
We do have staff from Water Utility and Health and Human Service.
Okay.
Do we put electricity in the water?
Yeah. Well, how about from Health and Human Services first?
Good afternoon. I'm Janet Pichette, staff toxicologist with the City of Austin Health and Human Services Department.
Thanks for being here, Janet. We have seen reports at times in the past from Dr. Wong with respect to the appropriateness of the city's current policy with respect to fluoride. I can't remember exactly when the last report was. Do you happen to know?
I do not actually know when the last date of the report was.
It seemed like it was at least a year ago. Does that seem right to me?
Yeah, and our position hasn't changed based on that report.
The reason I ask is that the warning that has been suggested refers principally to the CDC's action in January of 2011, lowering the maximum level of fluoride recommended in tap water from 1.2 parts per million to 0.7 parts per million. And what we've heard is that there have been efforts around the country to bring this action to the attention of governmental entities and seek a warning to the public. And so I'm curious as to a couple things. Number one, whether any of the health organizations that we've previously heard from on fluoride have weighed in on the appropriateness of a warning. And secondly, whether any jurisdictions have taken up the issue of a warning and have considered it and have decided one way or another whether to offer some warning to their water utility customers. Have we been staying on top of that? Have we been surveying those sorts of developments over the course of the past year?
I mean, I think what's happened over the course of the past year is that we have, reconsidered the information that was provided based on the National Academy of Science and the National Research Council, as well as recommendations from CDC and the US EPA. And basically our position stands based on those initial recommendations. Now, whether other municipalities have issued warnings, I'm unaware of that. Whether or not, I don't know if the utility could address that, if they are aware of anything, but I, as a health department employee, have no idea.
And I did recently hear from a representative of the Texas Dental Association who was cautioning against a warning, saying the addition of any type of warning to water bills will only cause unnecessary fear and confusion. But I don't know. I don't know if the American Dental Association or other healthcare organizations have offered any guidance with respect
I
to
know
warnings.
I saw 2 letters, I think, that were addressed to the council members that came from the Texas Dental Association and also the, I believe it was American Pediatric Society, who recommend against the warning or opposition to the warning.
Okay. I wonder if. Let me say, I don't think that I'm going to be ready today to take. I know everybody would like us to say we're going to vote to end fluoridation now. I don't think I'm there yet. I am not a doctor. I'm not a medically trained professional. I've been trying to pick up as much information as I can on this subject, but I am interested in hearing what health authorities have to say on this subject. And so what I would suggest is that staff take some time over the course of the next month to take a careful look at the healthcare organizations, including the major healthcare organizations we've heard from in the past on fluoride, and see whether they have offered any new guidance over the course of the past year with respect to warnings in particular, since this issue has been coming up in the wake of the CD's action in January. And I'd also be interested in any reports from around the country if other cities have been considering suggestions of warnings, have been weighing this issue, and what actions they have been taking. And I think if we could have an up-to-date report on those matters at the next meeting, then that would provide a very helpful basis for continuing this conversation.
We could certainly can do that for you.
Okay. So, colleagues, I would offer that as a motion, that we ask staff to take a look at those things and report back with recommendations at the next month's meeting.
So I don't want to ask you to repeat all that because that took way too long. Just kidding. So let me understand. You have a motion. You're making a motion that we direct staff to continue further conversations with health experts
to undertake a survey of developments over the past year with respect to any new guidance from healthcare organizations on the subject of fluoride or warnings associated with fluoride, as well as taking a look at whether other jurisdictions around the country have considered including warnings on utility bills.
And I mean, just for additional clarification, like when you say additional healthcare organizations, I'm assuming like the Texas Foundation,
Sure.
American Medical Association, and
Sure.
those types of organizations.
Sure. Sorts of organizations that we've heard from in the past on the subject of fluoride.
We'll be glad to do that for you.
So we have a motion. Is there a second? There's a second. Councilmember Morrison.
Yeah, I'm certainly supportive of that motion because it's needless to say, this is, I think, a challenging issue for all of us as I'm not a doctor either, and I don't have independent knowledge in this arena, so being able to try to juggle things and understand both sides. And I think Dr. Weissman, I think it was in particular, said, well, there's good science on both sides. On the other hand, we've also heard perspectives that it's all scientific fraud on one side. And I think that, as someone trying to figure out a reasonable policy, that's the challenge that we have. There are two other things that he said that spoke to me: the issue of informed consent and the issue of dosage control. And the informed consent issue, is a logical, for me, something to be asking. And I go back to, as I understand it, the City of Austin voters voted in the 70s to do that, to fluoridate the water. On the other hand, we're decades beyond that. So, how do you juggle that? I do have one question specifically related to dosage control. And, I've read what the CDC has on their website about recommending that for babies that are formula fed, and mainly only getting formula, that they suggest that parents use non-fluoridated water. And I understand that we have something on our website that addresses that issue. Can you talk a little bit about that?
Yes, ma'am. I think based on the new recommendations that were reported out last year, we did develop something so that people could make a decision as to whether or not they wanted to choose using city water to, make their baby formula and such, and make that decision based on information that was available. It's, I believe, on the Austin Water Utility website, and it was on the Austin Health Department's website at one point too. So, the last I saw was there. So.
I'm sorry, go ahead, please.
He just handed me the website information.
Can you read what it says? Or If it's not there, that's all right.
Okay, I mean, what it says is water fluoridated at a level optimal for oral health as used in Austin poses no known health risks for infants. However, some children may develop enamel fluorosis, a cosmetic condition, where faint white markings or streaks may appear on the teeth. Fluorosis can affect both baby teeth and permanent teeth while they're forming under the gums. If you are concerned about fluorosis, you can minimize your baby's exposure to fluoride in several ways. Breastfeeding is the best possible source of nutrition for infants. If breastfeeding is not possible, you can minimize exposure to fluoride by using ready-to-feed formula. You can also alternate using tap water and non-fluoridated water for formula preparation, or mixed powder or infant formula concentrate with low fluoride water, most or all of the time. However, if you use only non-fluoridated water, such as purified, demineralized, deionized, or distilled bottled water, to prepare your baby's formula, your baby's doctor may recommend fluoride supplements beginning at the age of 6 months. And then it goes on and provides additional history, as well as additional history on where we got, how we got to the point where we are.
Okay, so it provides sort of a whole big context
Yes,
from
ma'am.
our health department's point of view. Okay.
Yeah. And I think also the CDC's and, from the water perspective as well.
Right. Yes, and I was reading the CDC, what they talk about, and so it gets to be a little difficult capturing something in one line.
Right, exactly. I mean, it would be very, I think I think the warning is kind of not an optimal way to do that.
Because, so, yeah, no,
Because,
I think
I think, the water utility does provide information about what different types of levels of contaminants or minerals or whatever are in our water quality every year, annually. And so I think that is information that's disclosed to the public every year in their utility bill. I think, providing that information and then also information out on the website seems to be adequate from my perspective.
Okay, I appreciate that. And can you mention the website and where that information that you just read could be found?
It's at http://www.ci.austin.tx.us/water/fluoride.htm.
Okay, I appreciate that. And I think that one of the things that will be helpful for me will be to understand from the different organizations that will be surveying their perspective on the difference between, say, a warning on a water bill and that kind of explanation. Thank you for your help.
Sure.
Councilmember Riley.
Yeah, you mentioned the annual report from the water utility about substances in the water. Could you remind me about that? When does that go out? Maybe it'd be better to ask somebody from the water utility.
I'll defer that to Jane.
Okay, great, thanks.
Welcome, ma'am. Please introduce yourself.
Good evening. I'm Jane Brazier. I'm the Assistant Director of the Treatment Program with Austin Water. EPA and TCEQ require a consumer confidence report go out annually, and it gives water quality data, both what's in the water and what's not found from the previous year. We provide information on the maximum contaminant levels as well as the levels that we find it at. Also on top of that, in the water quality report section on our internet site, we give monthly data as well as quarterly water quality data throughout the year.
And the annual water quality report, when does that go out?
It's called the Consumer Confidence Report, and I believe it goes out in July of each year as a bill insert.
I have seen it, and I had forgotten about it, actually, but now that you mention it, I'll remember getting that insert. I'll confess I'm not sure I read it as thoroughly as I probably should have. So does that report currently identify fluoride as something that's added to the water?
I'm aware of what's on our internet site. The way we present the Consumer Confidence Report is specified on how you do it by the EPA and TCEQ. We don't have a lot of liberties to change that formatting. It does have the maximum contaminant level for the fluoride. It's got our raw water levels, our finished water levels. On our internet site, though, when you pull up the Consumer Confidence Report, on the right side, there's a link straight into the fluoride so that you can get all this information that she read to you from there.
I see. So it is available through the report on the website. It's not the report required by the EPA and the TCEQ would not provide enough flexibility for us to include additional information about fluoride. Probably not. Okay, but we can add stuff on the website.
Yes, we do, and we do. Right. Since it's been created, it has remained on our website constantly.
And was that information adjusted in the wake of the CDC's action in January?
Right. That information, the 2 paragraphs she read to us, were provided to us from Health and Human Services.
And after the CDC acted in January,
yes.
So that warning was included.
Yes.
Okay. Well, I will be.
Jane, can you tell me, if you know this, what the annual cost is for that annual insert?
I don't know.
Do you think we could get that as well? I mean, one of the issues that comes up is the cost of adding information or adding an insert, and
right.
we really need to pin that number down. And if we're already doing it, it seems like it would be fairly easy to give us an estimate of what it would cost.
Are you wanting in addition to the Consumer Confidence
Yes.
Report, or in general how much it costs for bill inserts?
How much it costs for an insert?
Okay. I will get that information for you.
Thanks so much, Jane. Appreciate it. Bert, since you're the ACM over Health and Human Services and Carlos had to go to another meeting, I wanted to see if you could respond. Carlos is fairly new, and I really wanted to ask him as our new Health and Human Service Director for his best advice and position on this issue. Could you speak to conversations you and Carlos may have had and where he is on this issue?
Well, Bert Lumbretta's Assistant City Manager over Community Services. You are correct. He hasn't been here that long, but he has had extensive discussions with Dr. Wong, and certainly because of the fact that we look at the recommendations from the CDC, and which is really the authority that we look at, and it's fairly common amongst municipalities. This is not the only city that looks at that information. I don't believe that he has had a whole lot of time and extensive involvement in looking at the issues itself. I think the recommendations that the subcommittee members are investigating in terms of looking at what other communities are doing in terms of warning labels or other actions, I think is a prudent step, because I think that gives you a sense of information to look at, what other cities are already considering. But in terms of his position or his comment in terms of where he is on this, no, we have not. He has not landed on any particular issue, but I think he's confident enough that what Dr. Wong has provided you has been the extent of what the medical authority from the public health side can offer in terms of their position. At the end of the day, the council has the liberty to take whatever action you feel is appropriate, whether it's a warning label or other action. What he's providing and what Dr. Wong is providing you is the best information available as it comes from the national side in terms of the overall position and what cities are looking at across the board. So I know that doesn't give you a direct answer, but to give you a straight answer from his side, no, he does not have an opinion one way or the other. He has basically relied on Dr. Wong and the position that he has presented to this subcommittee in the past.
And I can certainly appreciate him wanting to understand the issues more, just like we do up here. But I think as this conversation goes on, if this motion passes, I will, I as a lone council member can't speak for the other two up here, but I would certainly like to hear his position and like for him to take a position and explain that position to us. I mean, I think that's critically important for us, not to use staff as scapegoats or crutches in any way, shape, or form, but he is the head of our Health and Human Service Department, and I'd really like to hear his thoughts and his recommendation as well.
And I think he would be very willing to do that. What I'm stating to you is that he's not taking a position at this point.
Understand. Thanks, Bert.
Sure.
Councilmember Riley.
Yeah, I'm glad to hear about the information that we currently have on the website. I think when you look at the warnings that the CDC has issued, what you see is a lot of information that actually goes into some detail, guiding parents about how they can make decisions about how to take care of kids and what are the appropriate steps to take. And I can see how that volume information might not readily lend itself to being reduced to a little blurb of information that's stuck in a utility bill, something that someone is going to glance at it and throw away. And so I'm glad that we do have some robust information there on the website. I think it may be the case that a lot of people who might be interested in that information aren't even aware that the information is out there on the website. So as we look at the options, it seems like one option to consider might be just some very short reference somewhere on the utility bill or on an insert, telling people that if they're concerned about fluoride or other substances in the water, they can go to this link. And so just could be just that one line in the utility bill, somewhere in the utility bill, and then people could go consult the website and they'd see all that information. And that information could be out there year-round at no cost, and it could be updated as new information becomes available. So that's just one option to consider. I'd be interested in hearing what health organizations or what guidance health organizations are offering on this and what other jurisdictions are doing. But I think there are a variety of ways that we could get that information out there.
The only other suggestion I would make is that in addition to a website link, that we actually have a phone number. I realize not everyone has internet access and or phones, but providing as many mediums as possible for Q&A and getting information would be something that I would hope that we would explore. No, ma'am. The public testimony has concluded. There is a motion on the table by Councilmember Riley with a second from Councilmember Morrison. Any other discussion? All in favor say aye. Aye. Those opposed? That motion carries unanimously. And there are no other agenda items, so without objection from the committee, we are adjourned.